So we're quickly trying to look at bacterial vaginosis infection. So we are looking at the clinical features of the bacterial vaginosis. So next, on the clinical features mean like the signs and symptoms, right? What the patient will present with, and that's like what they will complain about and what you could actually notice or observe by yourself. So for bacterial vaginosis, you could actually see the different ways. So there's fishy odor, okay, and there's like a discharge. All right, and you can see that the vaginal walls are kind of like stacked up with growth of fungus and all of that. So later on, you can be having yellow-green gray discharge. All right, so it just depends on the stage at which the disease condition is at. Okay, so for the bacterial vaginosis, we said that it's a common vaginal condition. It results from imbalance in the normal flora in the vagina. That's like normal levels of like microorganisms in the vagina, okay, is distorted. So the pathophysiology is usually the normal bacteria that should be in the vagina regulating things. You are losing it, so they call that the lactobacilli. Okay, so there's overgrowth of anaerobes like the Gardnerella vaginalis, the Prevotella species, the Mycoplasma hominis, and a lot of other ones. So the pH that is normally maintained, okay, at acidic level, that's 4.5 of the vagina, the pH is now kind of like becoming basic, okay, because hydrogen peroxide production is like being reduced. You understand? So symptoms, that's what the patient will be complaining about. That's the girl child, what should be complaining about. The vaginal discharge is thin, is white or grayish, is fishy and foul smelling. Okay, the odor is the most prominent symptom. Okay, so mild vulvar irritation. So rare issues is painful urination, painful sexual intercourse, right? But just like that one is rare. Okay, so moving to the next, clinical findings. There's wet appearance of vaginal walls, no inflammation, strawberry cervix appearance, clue cells. So vaginal epithelial cells are coated with bacteria seen on microscopy. Then if you do a whiff test where you are putting potassium on hydroxide, like if you add potassium hydroxide to the discharge of a woman having this, the fishy odor is usually more. Okay, so these are the diagnoses where I try to pick up for all these criteria. Okay, so complications, it could lead to preterm birth, it could lead to miscarriages, it could lead to the infection spreading to the amniotic sac, leading to inflammation of the amniotic sac in pregnancy. So that's it for bacterial vaginosis.